Hi ladies, Juliet here, host and admin of the group, and for those of you who don't know me, I'm a natural fertility specialist and fertility coach. I just wanted to pop into the group today and answer a question that I was asked yesterday by a member of this group, and it's a question that comes up a lot and requires a bit of an explanation. So I thought I'd make a video and share it in here for those of you who can relate and who would like an answer. And that question is, what does it mean if your period is late, but when you do a pregnancy test, you get a negative result? So at some stage or other, you're going to experience a late period, whether or not you're trying to conceive. So your period might be late by 1 or 2 days, it might be late by a week. Sometimes you might even skip a period entirely and be overdue by a month or more. And then because of your late period, when you're trying to conceive, you do a pregnancy test and discover that actually the test is negative. And of course, when you're desperately trying to conceive, this can be quite devastating, especially if you've convinced yourself that this time your late period means that you have conceived. So what's going on? What does this mean? There's actually 5 possible causes behind a late period and a negative pregnancy test. So I'm going to go through each of those 5 causes one at a time. So the first possible cause of a late period and a negative pregnancy test is that you haven't actually ovulated this cycle. Now, it's not uncommon for your body to decide that now is not a good time to have a baby, and it stops you from ovulating. And this is usually because of some kind of stress. So it could be mental or psychological stress because of things that are going on in your personal life or your work life that's causing you to feel anxiety or stressed. And it can also be due to physical stresses such as being sick or ill. Maybe you've gone to hospital and had an operation. Travel, especially if it involves crossing time zones. And even excessive exercise is interpreted by your body as a form of stress, and that can stop you from ovulating. And of course, without ovulation, you can't get pregnant. Now, in this case, you will eventually bleed. You will eventually get what looks like a period. It's actually not a true period if you bleed without ovulating. It's what we call an anovulatory bleed. But eventually you'll get a bleed, and normally that will reset your body and you'll then go into another normal menstrual cycle where you do ovulate. So that's scenario number 1. The second scenario is that you ovulated late this cycle, or you haven't yet ovulated, so it's still going to come. Now, a late ovulation will mean a late period. So your period will come anywhere from 10 to 16 days after you ovulate. So if you have a late ovulation, then 10 to 16 days later, you should get your period if you haven't conceived. As an example, let's say you ovulate on day 25. If you had a late ovulation on day 25, you'd expect your period anywhere from day 36 to day 42 of your cycle. And remember, when you're counting your menstrual cycle, day 1 is the first day of your period. Another example would be if you ovulated on day 35, and then you'd expect your period anywhere from day 46 to day 52. So if you've had a late ovulation and it's not yet 10 to 16 days after that ovulation, then technically your period isn't actually due. It is possible to get pregnant from a late ovulation though, and this leads me to the next possible scenario. So the cause number 3, or scenario 3, is that you've had a late ovulation and conceived, but it's too early yet for a pregnancy test to show positive. So if you suspect you have had a late ovulation and you think you know when you've ovulated, you'll need to wait 14 days before you can feel confident that you're going to get an accurate pregnancy test result. Okay, the fourth reason for having a late period but a negative pregnancy test is that actually you did get pregnant this cycle with a normal or a late ovulation, but sadly you're about to have an early miscarriage. Now, in this case, if you'd tested earlier, you'd probably have seen a positive pregnancy test. But now, because unfortunately the pregnancy has ended very early, your pregnancy hormone HCG has dropped, and it's dropped below the level that will be picked up by a pregnancy test. So this is also known as a chemical pregnancy. If you do have a chemical pregnancy or very early miscarriage, please know that this is not your fault. It's not due to anything you did or didn't do. You can't normally prevent these early miscarriages from happening. And they're usually due to a genetic abnormality which will prevent the embryo from developing normally into a healthy baby. They're usually just a one-off, and then you have every chance of conceiving over the next few months. Okay, the fifth possible cause behind a late period and a negative pregnancy test is that you have a certain type of ovarian cyst. Now, a cyst is just a sac or a pocket inside your ovary that fills with fluid. And although it can sound scary, ovarian cysts usually occur through the normal process of ovulation. And they aren't normally a problem, but they can delay your period. So usually these cysts go away on their own. They don't normally cause problems. But if you are experiencing any pain or discomfort, or if you're worried, then do please see your doctor. So those are the 5 possible causes behind a late period without a positive pregnancy test. So the first one is you haven't actually ovulated this cycle and you're not going to. The second is that you ovulated late this cycle or you're still going to ovulate. The third scenario is you've had a late ovulation and conceived, but it's too early yet for a pregnancy test to show positive. The fourth possibility is that you did get pregnant this cycle with a normal or late ovulation, but sadly you're about to have an early miscarriage. And the fifth possible cause is that you have a certain type of ovarian cyst, which normally will resolve and go away on its own. So the big question is there a way to find out which of these possibilities apply to your situation? Retrospectively, it can be really difficult or even impossible to know exactly what's happened for you. And sometimes, especially in the case of an ovarian cyst, you may even need to get an ultrasound through your doctor. But the one thing you can do for the future to give you the most information and to give you an answer as to what's happened for you is to learn to chart your fertility. Now, by charting your fertility, I mean learning to observe and interpret your natural signs of fertility. So that's primarily your basal body temperature and your cervical fluid. And by charting your fertility, you'll know for sure if and when you've ovulated. And this is the number one piece of information you need to know if your period is truly late and what might be going on. And in combination with a home pregnancy test, it will also tell you if you might have had an early miscarriage or if you might have developed one of these ovarian cysts that I was talking about before. Now, if you're interested in learning how to chart your fertility and how to use it to figure out exactly what's going on with your menstrual cycle every month and to help you get pregnant as soon as possible, I'm just about to release my online course, the Fast Track to Pregnancy program, which covers all of this and much more in detail. So I'll pop a link to more information in the comments below for those of you who are interested. Okay, so I hope you found that useful, and of course if you've got any questions, please don't hesitate to pop them in the comments below or any feedback that you've got. That's it for today. Have a great day, look after yourselves, and I look forward to seeing you again soon. Bye for now.